So I know some of you may not have attended all the previous sessions, but this has been kind of cumulative to a lot of very focused symposium style invited participant type discussions. And today I think we really just want to, we haven't pulled this particular group together before of funders and public and government. So I think this will be a very different discussion than we've been having, and I very much look forward to it. I think what we want to do is delve into each of the key actions, and I don't know if there's a way to put them up, PHS folks that are on the phone.
Yep.
Just to have a reminder. I don't know if you have the deck. I printed it out, so I have a copy, but I think, we just want to have each of you speak as a representative of your sector. We don't want to necessarily delve into the issues of interrelated sectors or other sectors because we're trying to get to concrete actions that this sector can take. We will probably hold general discussion till the end if we have time. So we'll spend 45 minutes kind of going through each of the key actions and some structured questions. And then we'll recap for the last 10 minutes or so of the session. And we have to report back. So I need to take good notes. So again, narrow focus, one person at a time, kind of ground rules. I think the first key action, secure, diversified, flexible, and sustainable funding for a citywide community resource network. And based on our previous symposium sessions, it was clear that limiting access to community resources based on just healthcare affiliation, so you had to kind of go through your plan or go through your provider to then get connected to resources, it impacts health equity in New York City. Especially since there's still a large undocumented population, and still so many people are disconnected from regular care. So based on these conditions, the roadmap recommends a diverse funding model and infrastructure that allows accessibility for all New Yorkers. So folks can enter into this network from different touch points. Given that, what do you see as the funder, philanthropist, government potentially role in financing a community resource network? And I'll just open it up with that question.
Can I weigh in?
Yes, please.
So just, I think on the smaller scale, I mean, there's obviously large scale needs for central infrastructure support, but apart from that, on a smaller scale, a lot of agencies don't have and we saw this in district conversations as well, they don't have the readiness or the capacity to deliver in the way that healthcare systems would expect. Which is a much more business frame than the average human services world. And so on a smaller scale, there's support for agencies that have promise with regard to delivery of important outcomes to get them to a point that they can.
So that capacity building piece of it within the CBO network. And I think, what I've heard state Medicaid leaders say to this point is they don't even know who they are at a hyper-local level. And so how do we even create that connectivity between things like DSRIP and the 1115 waiver with these culturally competent, super person-centered CBOs?
I can jump in. I just kind of building on Rachel's point, I'm thinking, this is probably easier said than done, but, oftentimes, philanthropy might be there at the beginning kind of for proof of concept on the infrastructure. And then, leading towards this more kind of sustainable response. I think in this case, it does seem like there's a lot of coordination needed. There's probably been, in some ways, some of the proof of concept has been achieved on a smaller scale, whether it was through some of the smaller district networks or big district networks, or even the work that PHS has already done. And I think as the philanthropic sector would probably need to be coordinated together to kind of know that the long game is that there's the kind of sustainable infrastructure, either through waiver funds or through other, insurance and reimbursement streams. So I could see like the proof of concept for the infrastructure, although some of that might already be set up.
How would you recommend, Avital? I mean, how does one coordinate the philanthropic?
That is, I mean, in some ways, there is a lot of informal coordination already in place amongst all of us, especially I think in New York City. And so I think there's probably some opportunities to maybe have some, smaller discussions with specific ideas about what might be, because I think in general, even in the New York City sector, one philanthropy wouldn't be able to cover the cost of some of these initial even capacity building. Even if we all came together, I bet you some of the capacity building costs are, more extensive than a typical philanthropic or foundation grant. So I think there's probably opportunities, for some of us to kind of come together and have these conversations about specific ideas, and we have some ways that we already meet, and maybe there's like a briefing opportunity. Rachel.
I mean, just a second, Avital,
Yeah.
do a lot of co-funding actually, with a lot of backdrop conversations that have us collectively reaching out and have others reaching out to one, and then we bring the others along. Primarily because many of us, including large foundations like the Trust, don't actually make grants at a Robin Hood and RWJ scale. And so we come together in order to sometimes co-fund and increase what we can contribute. So there's a pre-existing MO for that.
Yeah.
Oh, somebody else was jumping in.
Oh, no, go ahead.
Hi, everyone. My name's right there in the little box, so I don't have to say it. And I, of course, don't have as much of the New York City specific context. But I guess the thing I bring to this is having thought about it sort of with other places as well. And so I just want to sort of build on the things I just heard you all say and add a couple more ideas in the mix. So thanks for letting me be a part of this. First of all, Rachel, when you said the thing about it's a smaller thing, it is not a smaller thing. The CBO capacity piece and workforce.
Not across the board, it's not small.
Right, and it's not, I mean, we feel like these things end up being all so much about the technology, and it's so not. It's actually, and as hard as that is, that's like the easy part. And the sort of the CBO network piece is, because it has all the layers of capacity and workforce and relational pieces and trust pieces, it just ends up being like more and longer and harder. So I don't want to downplay that as like a lesser, it's actually, I feel like maybe the more important part. Mm-hmm. So I just wanted to appreciate that you said that first, actually. And then to not leave, it's not just capacity for like the IT data capacity, it's also a human skill capacity and the ability to transfer skills when new people come and go and all that stuff, the CBO world. I really appreciate this idea. Like, I know that New York funders get together already, like you all were just saying. It strikes me also that there's an opportunity and a need in these potentially for using funder power to shift power to the CBOs. I feel we learned a lot from Nonprofit Finance Fund about situations where they were helping groups of CBOs develop contracts with payers and provider organizations. And there's just so many things that make it hard. There's a lot to learn from them and what makes it hard. But the power, so much of it boils down to the power imbalance. And there's got to be stuff that groups of funders together can do to shift like the scales in favor of the CBOs. And then, but then also this other thing that we'll talk about in a minute, because it's another key action about how the degree to which it can be like community led and the accountability to community can be built in. But I know we're talking about the financing and that piece, but I just wanted to say, because the power, it ends up being tied in. And then I just wanted to bring up, have you all, before I'm new to this series of conversations, have you all brought up the idea of like a trust, starting like a trust for like a shared fund for this. And that maybe it can be a part of the sustainability plan, that it's not relying on like one grant after another that are coordinated, but we develop some sort of trust to support it.
That's a great idea.
That's fascinating.
Hillary. That's fascinating. And I do, so Commonwealth Fund had helped fund some of the NFF collaboration. So they put out a very, very honest learning report on it. And I encourage all of us to go read it because it is just the truth. Coordinating with healthcare can bankrupt CBOs. So to Rachel's original point, this is not just difficult, it's actually costing CBOs resources they don't have. Mm-hmm. So I think we have I have 5 really amazing ideas on funding. So let's keep going and maybe move on to key action number 2, which is creating an administrative backbone and infrastructure to support and facilitate the work of community-based organizations at all levels of capacity. And so we've already discussed respectively in our jobs and also in some of the previous symposium discussions on barriers to collaboration across sectors. We just all uniformly agreed that capacity development for CBOs is critical to health equity. And in New York City, many small culturally specific organizations are really essential to reaching the most vulnerable, hard to engage populations. So in previous sessions, we identified the need for both internal organizational capacity development as well as capacities and capabilities to manage an effective network. That we've used the term in the funding world, integrator organization. It's, some people think of it as an MSO model. In your view, what do you, I think we've agreed that there is a role for funders in building CBO capacity, but what would you think about support or building on this idea of a network administrator or that kind of managing entity as we think about the CRN approach?
Are you asking whether, I'm sorry.
No, go ahead. No, I wanted to sneak in a last comment on the first action item.
Oh, yes, sorry, Tony, I missed you. I know you were trying to speak. Go ahead. Sorry about that.
No, I mean, I think it was implied in the discussion of the last slide, but I think it actually would be very helpful to distinguish funding for capacity building of CBOs versus funding for ongoing services, because I think the sources for those are very different or could be very different. And then secondly, and we've been talking about this forever, but it would, I think, be extremely helpful for funders as well as for government to get a sense of what scale of funding is required. Because there's a very big difference between tens of millions a year versus hundreds of millions a year, and that might guide us to where the appropriate funding source is. So, and I actually never seen someone try to quantify the dollar amount, but again, I think for the purposes of advocacy, I think it would be very helpful. And then on just a quick comment on key action 2, I know a lot of this discussion relates to the 1115 waiver, but this one in particular seems like it's very difficult to have a discussion without knowing how the 1115 waiver is going to turn out, because you don't want to create 2 structures that are trying to create administrative backbone and infrastructure to support the work of CBOs. And so, this one in particular, I don't know if we want to get too much into the weeds or more focus on how we want to shape the 1115 waiver, so it's consistent with what we think we need in New York City.
Yeah, and Tony, our thoughts are, I mean, it would make all the difference in the world if there is a real 1115 waiver that provides funding for as what they call social determinants of health networks. And so, you know, again, the output of this work is intended to, one of its uses is to ensure that that gets designed in a way that, you know, supports this kind of thing. Not that there would be multiple structures, but that, you know, we create a single kind of infrastructure. It might have a number of lead entities, but with some consistency in how that's rolled out. There is the potential reality, and I don't think it's completely unlikely, that it's not going to happen in an effective way, in which case we're back to, I think, the same structure, but with more funding challenges.
Yeah.
But I agree with you entirely. The intent is not, you know, to try and layer multiple network structures with additional costs. And frankly, that all rolls back to huge burdens on small community-based organizations to meet every structure's requirements, which is what exists now.
Mm-hmm.
I wonder, Tony, building on your point, if there's value in a small planning grant to something like PHS to do the required analysis, estimates, and potentially set up an evaluation framework for the 1115 waiver SDN component, so that we actually can real time see the gaps in that type of approach and then pull together a pretty, you know, we've seen from COVID, we need to move fast. We need to create the infrastructure pretty quickly. So I don't know if that's maybe the in-between to ensure that there is some entity analyzing the developments around a infrastructure backbone.
Yeah.
I think timing is very short for that, though.
Yeah.
In terms of influencing the concept, at least.
No, I agree. I think it's around that second point of, if it does happen and it does get executed, you know, we can't wait 5 years for, you know, a RAND report or to see if it worked. Like that's been a really big, I think, frustration for funders.
Yeah.
Is that you don't really know how it's going.
Yeah. And I guess the other point I would make, and because I know we've all been in these discussions for the past 5 to 7 years, which is, you know, the very small CBOs that are fiercely independent, you know, we talk about creating networks and infrastructure. It would be good to get a real sense of whether or not they want to be part of an infrastructure, or they want to remain kind of fiercely independent doing what they do. And we saw the same things with physician practices, right? We still have those mom and pop physician practices that are fiercely independent and don't want to join broader networks. And, you know, what do we do with that in this type of situation? And,
no, Tony, and this is, you know, I can't say it's comprehensive, but we've been doing work in all 5 boroughs. We have found the really small CBOs, because that's who we bring into all of our, you know, we work with big ones as well, but we always want the smaller, more culturally focused CBOs to come into the network work that we do. And they have been very interested in doing it. The main issue is what are the administrative costs and requirements, and are those covered? And can we train them to be successful? I mean, the whole idea is by participating in the network, you're going to get additional referrals and much closer relationships with other CBOs to meet client participant needs. So we haven't found that sort of fierce independence, we don't want to have anything to do with this, to be a very large factor. It's much more the realities of the logistics of participating and the costs of participating. But we would obviously suss that out more scientifically.
Yeah,
I mean, one thing, Lisa, is that, you know, there's a lot of cynicism about that you'll get more referrals, because in the disrupt era, people entered into various arrangements and put a lot of time and effort into crafting a role in a network and didn't get very much on certainly not compensated referrals.
Correct.
So there's a lot of cynicism about what the return is.
No, I understand that. And again, with a very coordinated, integrated network, the reality is a little different. I'm not sure, you know, we certainly haven't been able to say there's an ROI, but again, the key is to be able to, if you're not already compensated for the work that you're doing through a government grant or something, to be able to, you know, support that.
I mean,
So
I wonder.
I
Sorry,
like
go
the
ahead, Lisa.
idea of aligning with the 1115, you know, shaping it in various forms, just because as I think about durable funding sources, you know, I like the idea of tapping into 90-10 matches, right? So wait, even before 90-10, right, any available money related ARP money or money related to HCBS programs that have been rendered to states and have have a hard deadline for use, right? Somewhere, depending on the nature of the grant, as you guys know well, somewhere between the 2023 and 2024 timeframe, right? So the idea of using that and then using the 90-10 match, right, to sustain an infrastructure like this. Because as long as it services Medicaid, you probably need some match money to come from the private sector. But, you know, let's assume 3/4 of this, the beneficiaries served by this network would be Medicaid eligible, right? Then you can get a large portion of the cost covered on a durable basis through federal funding and not beholden to state economic conditions. So I think I like the idea of trying to align and sync up. The other advantage it has is, you know, we see this, I'll give you a different example. We see this as a concerning zero-sum game, right? In behavioral health, there's just so many virtual care providers, but they're all glomming up very scarce behavioral health care resources, largely to service the commercial population. Right. And so what I worry about there is, you know, I get easy button access, you get easy button access, but who are we leaving behind? So having some infrastructure that, you know, basically, you know, the way you'd offset the cynicism, right, if I may, is to say, okay, we'll front the cost of building this network so that it's less onerous on you, right? So that you don't have to kind of expend money on your end without any visible return yet. So for those reasons, I think I like the idea of trying to, so in this case, you're like, well, what does behavioral health have to do with this? My point is that the same, CBOs are going to be engaged by NowPow, by Unite Us, by every health plan, and then every incoming health plan if the managed care structure starts to change, right? And so I think it's better to push for at least some, I think having some infrastructure at least creates transparency around the resources and supports equity, more so than the alternative. I recognize, you know, that the kind of, you know, people will be cynical about like, oh yeah, here comes another proposal for an administrative network. I get that, and that's the thing to sort through, but I can see why it's important.
So just to build on that a little bit and get a little bit more concrete, I think a question here is also, what would we want that network administrator, that backbone to handle? Because I think, you know, Unitas just launched payments, for example, right? But if you actually look at it, it's like a Venmo function. It's not actually creating, it's not any of the things we really just talked about yet. It could become, let's hope, you know, let's keep positive here, but it's not giving funding power. It's not driving the money back to CBOs to let them invest. It's not using any evidence-based practices to inform CBOs what rates to charge for their services or even how to determine that. So there's still a lot of gaps that a network administrator could fill. So what I think, if we could spend less than 5 minutes just talking about the actual role that these types of administrators could play, would be great.
Could I jump in here? Oh, sorry. I was just going to say, the Department for the Aging, we were actually running our own MSO, so we've had a little experience on doing some of these things, although albeit from the Medicare population. So I did want to put a plug in that, you know, while I do think Medicaid is important and, you know, following what they're doing on that, I don't want to neglect the fact that Medicare Advantage plans, we've had more success in getting funding. So, you know, it's important to look at what they're funding on the social determinant of health side. So just that plug. But in terms of our experience with the MSO, we've done a lot and found that, like, we can do, you know, we also found that the smaller organizations and the larger actually wanted to do it on their own and then were struggling and then came to us. So actually, even though they wanted to be independent, found they were getting more bang for their buck, approaching some of the funders that way to unite. But we've over the course of the past 2 years working with different plans, we found there's kind of two roles that are really important for our administrative side to play, in that, you know, we can do some of that marketing and analysis and kind of not rate setting, but figuring out what the rates might be most beneficial for people, and setting up some of the infrastructure, but then also the capacity building side for maybe some of those organizations that aren't even ready to join into these partnerships, that need help building up their compliance and insurance structures and privacy and security and all of that. They have no idea, you know, this is a whole new world for a lot of these smaller CBOs, and workforce development, training, data reporting, all of that, you know, needs that TA just in order to start partnering. So we've seen two types of large organizations that are ready to do that, but need the admin kind of negotiation tactics that maybe a coordinating entity can do, but then the capacity building side too. Sorry, Rachel.
I just wanted to sort of pick up on something that I think it was Hillary from RWJ was saying earlier, which is in terms of the capacity needs that this function for the hub would be supporting. There's a pretty wide range, and some of it is contracting and rate setting and so forth, but some of it really is the culture of program and service delivery. And because that culture is not always a good match for the, you know, we're going to deliver this, we're going to do this, deliver this outcome by Thursday. You know, like, it's not tight. It's human on the ground. And so a big question here is what is realistic really for a hub entity to take on in terms of capacity and facilitating, supporting capacity, you know, training and technical assistance. It would be a whole enterprise unto itself.
Yep.
And it would have to ally with other training and TA nonprofit service providers, so as not to take them over or compete. But that's very different than there's the program side and the technical side, and it's not, if you were biting off the whole thing, it would be probably, it might not make sense.
And I really want to add,
go ahead. Go ahead.
You weren't done.
No. Go ahead.
I was just saying, and a relational side, because let's see, there's a bunch of places I've learned from for this, but one nearby is Trenton, and another big one is the state of North Carolina. And so I'm especially thinking about them when I say this. And there's a lot of things that's going to make this go slower than we would hope or expect once you get into it. And one of them is not just this capacity, but is this thing about trust. And so there's the technical piece, and there's an administrative piece, and there's also like the holding the relationships, and you can break those further into what are the actual key functions that need to happen. You might come to a place that you realize you need more than one administrative structure for this, that's to fulfill these purposes, but there does need to be something that, and maybe it looks like a board that's like a sort of like a consumer patient user sort of like community member board, because another one of the things is like accountability, right? And this idea of like shifting power more to the CBOs and people to rebalance it, and how you can create structures that enable that sort of shift of power and accountability. And so I don't have all the answers. I just want to like enter that these are really important things, because if you just built it for the administrative role, and you sort of, and you make it a like build it and they will come model, it's going to take forever to build trust, and you're not going to have it. So as opposed to if you start with like hey CBOs, bring folks you work with and serve, like let's come together and talk about what you need, and then like the structure feels like it comes from that, like you're starting with a method from the start that enables more trust, has the more potential for trust, that you can hopefully like blend it for organizations that didn't participate at that point. Maybe they see that it was built in this model, they're more likely to trust it. I just wanted to throw in those things. And I mentioned in passing the sort of patient consumer client board, but I actually feel like it's going to end up being important in a lot of ways, and
Yeah.
we can talk about it more in action 3 or 4 or whatever.
Exactly. This is a perfect segue to action 3. So I don't know if folks have any, parting thoughts on this particular discussion before we move on, because it is what we want to discuss next.
I just want to add one little detail. We have been thinking a lot about how to do a community advisory board. But I will say that our approach in every area that we take on is we don't design it. We do a social design process with the community-based organizations who initially are involved. And then that can be modified community by community based on sort of unique needs. So, and when we have contracts where we're paying for services, they're all performance-based. So I do think there are things, I'm not saying it's quick and it's easy and it's uncomplicated, but there are ways of putting it in place which don't typically happen if a managed care organization or hospital are putting this thing together, that we found to be very successful in building the trust to actually make a true collaboration. Tanya, go on. Sorry.
Yeah. So I think that this is a good segue to action number 3. So if we could pop that up, it's to systematically build local community engagement and participation into planning, design, implementation, and evaluation. So it's really, I think we've all learned a lot from Hillary. I know I've learned a lot from, the Camden Coalition and consumer-led design. And so I totally hear you on those examples. I don't know the extent to which that happened at the scale at which it happened in North Carolina, but it was an intent. I just don't know if it was executed. And so I wonder, we've talked about establishing community planning groups. I guess I wonder, is this already built in to some of the thinking around 1115 in particular, or is this something that we need to, this is again a recommendation in design, and that the city of New York and kind of support funding this type of activity needs to happen, because it's not part of the existing proof of concepts or infrastructure development that's already kind of underway. So Lisa, I don't know the extent of this already happening, or this is like a need that we need to actually think about.
Just want to make one point about that is that in some ways answers some of the issues that were raised earlier, meaning that there's a role for small groups on the advisory side that might be completely different for groups that don't have the capacity or desire to be part of a service delivery network. So there's the advisory, there's agencies that are fiercely independent in voice, and they want a voice, but they don't have the capacity, the will, or the desire to be a service delivery network participant. So you might have 2 categories of engaged entities, which bifurcates the kind of capacity issue. Anyway. So that's not exactly where you were going right now, but it was raised for me when we were talking about the advisory role.
So Rachel, is that the distinction between design and advocacy versus service delivery? Can you define the kind of 2 roles you're thinking of?
Well, I was partly thinking about the small groups that are necessary to reach hard to reach communities in a city like New York, immigrant groups and so forth,
yep.
That are not going to be service delivery providers, but they may be very significant in their communities. And they may want to have a voice on anything that's sort of in the planning space, or the community needs space, or the prioritization of interventions space. So it just could mean that you have 2 types of engaged entities. How you blend them and put them together sometimes versus deal with them separately. At other times, I'm not answering. I'm just sort of pointing out that there are groups out there that would care a lot about being included in planning, but would not either be able or want to be service delivery providers.
And I would just jump into kind of build on that, and maybe something that bridges the two last discussions that we've had is that it seems like, and I think some of this planning work happened in theory, probably, right? Like there were at the beginning of district last time, groups came together. I think I don't know that it necessarily got reflected in how things got implemented, but I also think from a technical point of view, some of the challenge being, and probably what the community-led planning groups would voice is when it comes to the service delivery, and the PHS knows this really well, is the service delivery funding is so not aligned with this like flexibility around performance-based contracting. And so some like the largest programs, whether it's like WIC or some of the enrollment programs, staff and workforce on those programs have to adhere to these kind of line item budgets. They have little flexibility about how they use their time. And then from a more like planning perspective, there's and also the going back to that administrative role of the central administrative role, there's the issue around kind of overhead and time of staff who's in more leadership positions who maybe are funded by multiple grants or contracts, but they would need to contribute to that, either being part of a network or facilitating the contracting with the larger entity. And I do think there's probably from a local community engagement point of view, I just think there's some like logistical pieces that probably also need some more advocacy at the state level as the waiver might get implemented around how can these groups even, how do they have the staff time to be in a planning process? How does that get compensated? And then similarly, how do those existing grants that they operate their service delivery on, is there any openness to flexibility on those? And I don't know how, actually the PHS team might know better than me, how, if over time with district, did any of those kind of state-led contracts that allow you to do the service delivery, was there any wiggle room and flexibility? And I think that's like that's the reality on the ground. So from a planning point of view, it does feel like there is those advocacy needs to allow for people to even participate successfully and have the staff time to do it. But
I wanted to call out Deirdre, who has had her hand up. So Deirdre, did you want to?
Yeah, I just wanted to add on really quickly, like I was thinking about Rachel's comment about like that we may have to think about like maybe different groups, 2 different groups, like what that looks like. And when we're thinking about the advocacy piece, maybe it means that we have to open it up to groups that they're not CBOs. So, and people who are in the community that want to get involved. So that means like tenant associations. Like if we're working with residents who live in NYCHA, they have like resident associations. A lot of the times, like these are the people that are utilizing the services. So while they may not have the same setup as like a CBO, they probably have that capacity to do a lot of the advocacy pieces.
Yeah, I totally concur. And in fact, in Camden, the Camden Coalition is working on legislation where if a community member, a high utilizer of a specific service who's a Medicaid beneficiary, does get compensated, gets an honorarium or compensated for participating in some of these plannings, it doesn't discount their benefits, because what can happen is it actually can disqualify them from some of those. It has this perverse impact. So I think to Avital's point, like we need to, there's some minor movement towards actually compensation for these activities, but we also have to think about, when we're thinking about community members, some of them are disincentivized actually to participate. And so balancing that aspect, that very real and tactical issue, I think when you start doing client-based or consumer-based design programs. I think I like this last point, Deirdre, because that was the big piece of this conversation that was missing for me, which was how do we actually get a community designed solution? How do we actually identify the gaps? I mean, there are 1,000 flowers blooming right now in this space, yet needs are still not met and people don't know where to connect. So I think that last piece is really important. before we move on to advancing, you know, policy and practice and the ecosystem, especially a data ecosystem piece of this, any other comments on key action number 3? Yes, Hillary, I see your hand.
Two quick thoughts, and one, it relates back a little bit to the governance and also a little bit to the next one, and it is part of the juice, like the equity juice in this. There's a lot of things about the community engagement that it puts it there, but part of it is also how much actual power the groups that you bring together have, not just being like, tell us what you think and we may or may not use it, but can they actually help decide what the sort of the goals and the indicators of success are in some way? There's some things that are going to be built in because of you know, the waiver, because of whatever, but like, can they play a role in defining doing a good job and success? And that's going to be a big deal for the rebalance of power and the accountability and stuff.
Yeah.
Okay, and yet separately, the thing I wanted to mention is so there's like the way you engage people in groups and the structure, and we've just been talking about that. There's also like the way the technology, like the mobile technology, for example, and what it enables people to do. And this is where I think that there's like new, there's like opportunities, and especially in New York, to be an example on this and to think about not just how do we have a good interactive mobile platform where people can like look for help and find help and blah, 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 but also like, how can they share? Like, where are they finding useful things? What are they seeing wrong in it? Like, how can you make it a more empowering, engaging tool where people can share things they see and assets they see and like, oh, my church is doing that, whatever, like that, like think with people about how it can be more of a thing that they can use as a tool for this, and for the city as a tool to learn about how people see their lives around them, right? There's like an opportunity there. And that could also increase engagement and wider engagement beyond the sort of connective infrastructure you might set up for people to interact. That's what I want to say.
I just want to hop in real quick before we move on, and that, you know, some of this work, and I think the ideas coming that I'm hearing today are in place. I don't know if folks are familiar with the Fund to End Youth and Family Homelessness. They have a philanthropy fund. They have a community board that has a greater weight towards folks with lived experience. So just as a parting note for this one, for us to really kind of look at what's out there already that can be adapted and learned from.
Tanya, just a quick comment, just bringing it back to the 1115 waiver. At least in the concept proposal, and who knows, you know, what the final waiver is going to look like. You know, there's 2 layers of entities that are relevant to our discussion, right? We've been mostly talking about how it relates to the SDH networks, but there's overall regional planning entity, the health equity regional organizations, and to some extent, getting community engagement and participation into planning of that larger planning agency is more important, because that may dictate how the networks are set up or what their functions are. So as we think about this planning process, I wouldn't focus only on the structure of the SDH networks, but also on the regional the planning agencies.
That's a great point. All right, we have about 10-ish minutes left, so let's get to the last key action, which is employ regulatory methods and advance policy and practices that ensure a favorable technology ecosystem. Previous sessions identified the need for a consensus and standardization around effective data sharing and interoperability, which is key here, especially as we have a lot of vendors coming into the space to create favorable technology ecosystem for an effective community network. So what can funders do to specifically minimize the potential access barriers created by proprietary technology solutions and create this more interoperable, accessible, you know, data back to network? What are some thoughts on that?
If I can just like pepper that a little bit. the issue for making a network like this work is to not burden not to burden the network itself and individual CBOs, FBOs who are doing other work as well, to have to use multiple systems.
Yep.
And so the question is, and I don't know the political reality of this, is would the state pick a system? Or would, and I don't know that they're interested in this, would there be kind of an integrating system, maybe NICE or something like that? The question is, how do we create this in a way that doesn't have every CBO for each hospital and managed care organization that they're doing work for have to use a different system? And how would that get put into place in a way that would be funded and politically acceptable? You know, Now POW and Unite Us joining together, merging is a big move, I think, in at least reducing two of the bigger to one. But there still are other systems which healthcare companies and managed care organizations are using, and we have found them all to be incredibly insistent that their system be used. So that's the challenge in terms of how do we approach the policy or regulation to make this workable.
I mean, I think it comes through to me, right, like as, just as this state stipulates standards related to value-based agreements, right, the ones that were really actually successful in driving adoption said that you can't have, 32 flavors of ice cream, right? There's chocolate and there's vanilla, and that's it. And you can decide, I think the, you can decide, you have unlimited liberty to kind of how you choose the actual payments, right? Because that's a private contractual matter. But you don't have any flexibility in setting the quality metrics and the reporting standards, right? So what if you insisted that, everybody uses the same business associates agreement, right? There's no, like, why do there need to be, 100 flavors of BAAs that, you need to have that create so much administrative hassle for and a fairly standard file format, right? So I think by kind of driving standardization on not just the technology, but or the file formats and the data elements, but also the data protection agreements, which is key, right? And I think quite concerning for many, drive some of the skepticism on the CBO side. Those be two ideas, but driving it through the state, right, as a condition of participation in programs, both for providers and for.
Just to add on to that very quickly, I think we're already seeing the state's technology lagging behind. We know this behind private. And so, like, Avital mentioned WIC and SNAP. There are specific regulations that don't allow them to participate and share data. And I think, those huge databases, like, we're already kind of leaving them behind and really need to be working with state government to bring them along at the same time.
I want to hop in there just because when you mentioned WIC and SNAP, it makes me think of like the kind of, I don't remember what work like benefits data trust or efforts like that do in New York. But in North Carolina, one of the things they're trying to do is bring their Unite Us, the social needs referral platform, and their sort of eligibility connection platform with benefits data trust together so that people can get referred to the help they need and find out what they're eligible for and get signed up for it efficiently through like one portal. And I just wanted to share that's a thing that people are thinking about figuring out in other places, and you have an opportunity to sort of enter that in the mix here potentially.
I just wanted to add that there's there's funding need at the CBO level. Even if you had a single operative system, I can't tell you how many proposals we've gotten for support to become Now POW or RIO participants from CBOs, because it's not just, getting the system up and running in their as an IT matter, but it's training their staff and figuring out how to integrate it into their programmatic flow. There's and literally many proposals seeking support for just being a CBO participant at the CBO level of NowPow and Rios. So,
yeah, Rachel,
you know,
totally,
can I just say a reaction to that coming from the private sector? Like, what really bothers me about that is that is actually the job of the company to train their users. That should, to me, as a funder, that creates a weird support of their business model that they should be supporting. I don't know if other folks, Mira,
well,
I don't know if like you agree, but
they may do training that's about, you know, press this button and then press this button.
Well, then they need to do a better job.
But integrating that into service delivery is a different matter that IT companies can't do solo.
Well, just to speak to that super quick, I appreciate Hillary's comments around the power dynamic. So bringing those smaller CBOs in and bigger CBOs perhaps, or others giving them licenses, they still end up not owning their data. So it's the folks who pay for the license that own that data. And that's just further, you know, creating issues around this power dynamic.
So I think this is a huge issue, and there may be a funding role around that IT acumen or that integration piece of it. But I think that's also something that speaks to the lack of the lack of capacity building that the vendors are doing, to be honest.
The part of it is Tanya is holding, again, standardization and the vendor contracts, right? So the vendor will, like, it's up to, and so, just as hospitals don't get funding, philanthropic funding to pay for Epic migration training support, right? So I think you just have to set a precedent that, it's not just the platform license agreement, it's kind of this many hours of training, right? And this level of performance. Kind of that the fact that
and honestly, if they're getting North Carolina grants, if Unite Us or NowPow are getting state level grants to be the system, then they need to be held accountable as the vendor to ensure that is executed, so that CBOs can actually participate as users. So I think there's layers to this that that are very important for us to be aware of as funders and to consider. We have 5 minutes left. I think I have like 25 takeaways, but this has been a really good discussion, and I will do my very best to summarize in the next session. And please do jump in if I miss something. But I think, the big anchoring points is that we need to stay close to the existing policy levers that are out there. 1115 waiver. We need to consider not just what they're putting in terms of the infrastructure design, but also in the planning, and try to influence that. There's a lot of need to still support capacity building in CBOs and ensure that they are able to participate fully in these networks without going bankrupt. And I think, community engagement is critical and we talked about different ways to do it. To really ensure that this doesn't become a poorly executed, a lot of resources and a lot of time kind of sink that some aspect of the original disrupt did show. I know there were many other points, but I think, just to share some of the themes that came top of mind for me. Any other reactions or points before we will be suddenly taken out of this group? So
can I just add one thing to this last technology piece, and not to add another layer to what you were talking about, but I think it's really important to just twofold. One, I hear you on the vendors training. I think training is a huge important thing, but we've seen a lot with our CBOs, especially now with a lot of the requirements on the workforce. It's hard to attract the workforce at these CBO levels, that there's tons of turnover. So that adds to the complexity of training staff. But then also, and I've said this in a few other platforms and venues, is that it's not, technology helps, but it's not the answer to everything, right? You can get a perfect technology system to make referrals to the CBOs to create the perfectly happening system, but it doesn't replace the human interaction that's happening on the ground in terms of the services and the ability of the CBOs, like we saw this with Disrupt, with the referrals, you can send as many referrals as you want, and they could just sit there if the CBOs don't have the capacity to take on, you know, because they're not sufficiently funded. So a sustainability portion too. So I think it's important, but it's not the answer to everything.
Yeah.
Yeah, and Megan, I think this may go back to what are the standards that we require of technology vendors, but our own experience working with both NowPow and Unite Us is we get what they do isn't sufficient for us to be able to, for example, say we could participate in a value-based payment because we're not getting the information back that allows us to say exactly what happened and to assess how well it's working and where to focus to fix it. And they're very standardized. They don't want to make customizations, but so if standardization is a key, it needs to be defined around the kinds of data that need to be collected and shared in order to assess sort of what's actually happened in terms.
She was pulled back faster.
I told you it's super sudden. It always jars me. But
45 seconds. I'm going to throw in this other quick thing just to think about, and it is to think about also from like a public health point of view, how we want to be able to like learn from this system, so that we can learn about like the patterns of needs and gaps in services and needs, like at the sort of like the governmental, city-wide, regional, whatever level. That there's a big opportunity there to think about how to get pattern data about patterns of use and need and gaps out of the system.
And that could be a great funder activity, right? Because that's not built into necessarily some of the planning and execution.
211s are thinking about it more these days.
Yeah.